Now, doctors among those concerned about the Supreme Court's decision to overturn Roe v. Wade and how it will affect the way they treat their patients. Our Dr. Nandi joining us live right now. So, Dr. Nandi, you know, a lot of passion on both sides of this, but I got to ask you, how will treatment for miscarriage be impacted by this? What kind of conversations should be happening right now with OBGYNs?
Yeah, lots of emotion, but you know, from the medical standpoint, right, miscarriage, first of all, you know, could certainly be impacted. It's already happening in Texas. A miscarriage, I'll define for you, is a spontaneous loss of a fetus, Caroline, before the 20th week of pregnancy. So it makes sense, right, that some people think about miscarriage as something that you have no control over. That can be true, but it also can be something that people have to make decisions about. Remember, not all women can let miscarriage progress naturally. It can take 3 to 4 weeks for expulsion, so medical or surgical treatment may be needed, especially if there are signs of infection. Now, the standard of care for treating a miscarriage is almost identical to the standard of care for providing an abortion. There's nothing in these laws that says if there's a miscarriage, somebody has to prove it, right? But there are reports about doctors questioning patients about medications they may have taken or how they may have caused a miscarriage to happen. In practical terms, getting the right treatment on time without barriers or questioning might be very challenging. And this is problematic for some people.
Oh, yeah, I hadn't even thought about that. Well, a lot of women depend on IVF treatments, Dr. Nandi. How will IVF be affected now that abortion is banned?
Yeah, I think that overturning Roe versus Wade will not automatically outlaw IVF. However, a number of states, right, have trigger laws in place that could outlaw abortion if Roe versus Wade is overturned, including Kentucky, Texas, and Louisiana, right? So the short answer is that it could be affected. That's because the way certain words are defined in many of these new laws often don't match the medical definitions. In Texas, the law in place says pregnancy begins with quote unquote fertilization, when a sperm and an egg meet. But in medicine, pregnancy is defined as the beginning when that fertilized egg divides, grows, and implants in the uterus. So whether IVF will be limited to these or future laws is still up in the air. It's quite, again, another pertinent topic that we have to really look at.
Yeah, a lot of people concerned about it right now. What about hospitals? Are hospitals ready for this change? I mean, I know the ruling came down today, but a lot to be considered.
Important question, right? Rural areas, even before COVID, were facing lots of closures of hospitals, and particularly labor and delivery wards, right? People were traveling long distances to get all types of care, and women's health providers were leaving those areas. But many hospitals will be as ready as possible to meet the needs of patients who need care. I'm confident of that, because I think as medical professionals, what we're looking at is not the emotion, but how to take care of these women when the time arises. And I think my colleagues will step up and do everything possible to protect the health of women.
All right, Dr. Nandi, thank you so much as always for your time and, of course, your medical expertise. Appreciate you.
Bye-bye.